In Health Watch, a local push is underway to increase the number of nurses in hospitals nationwide. It's estimated the healthcare industry has lost 100,000 nurses over the past 2 years. And here in the Valley, 32,000 more nurses will be needed in the next 6 years. Many healthcare workers, including nurses, cited burnout for leaving their careers. Prior to the pandemic, Costa Health dealt with a 5% shortage of nurses. Today, the vacancy rate has hit 20%.
That gap is going to leave us in a lurch with trying to deliver quality care in all of our settings.
Educating the next generation has been difficult. School officials know how tough it can be to get into local nursing programs and say it is time to expand access.
So for all those people who've tried for years to get into a nursing program, whether it's at a community college or a state university or even a private university, please don't give up hope.
The U.S. Department of Health and Human Services expects 3.6 million more registered nurses will be needed by the year 2030. Congressman Jim Costa cited a survey which said 28% of nurses plan to leave the job within 5 years, and he has introduced the National Nursing Shortage Act.
This legislation will require the United States Secretary of Health and Human Services to establish a national task force to deal with the nursing shortage.
The news conference was preceded by a workshop where local healthcare officials talked about the challenge. They say it will take a multi-pronged approach to bring more nurses into the healthcare system.
It's a pipeline problem, it's an education problem, it's a hospital problem, it's all of those problems.
Lynn Ashbeck of Valley Children's Hospital commended Congressman Costa for what she called the national lens that will bring us regional and local solutions. Costa introduced the National Nursing Shortage Act last week. He hopes he can find bipartisan support and move the legislation forward by the end of this year.